This is a lecture for anterior cerebral artery anatomy. The anterior cerebral artery arises from the internal carotid artery. It gives branches to the medial aspect of the cerebral hemisphere and also to the medial part of the orbital gyri, to the corpus callosum and superior frontal lobe. The branches of the anterior cerebral artery are the following: the orbital branch, frontopolar, medial anterior frontal, middle frontal, medial posterior frontal, paracentral lobule, anterior internal parietal, and posterior internal parietal, and splenial arteries. For each of these branches, there may be a common trunk and 2 or 3 divisions, as we saw in the middle cerebral artery. The 2 different arteries may arise from the ACA, paracentral area, and sometimes a common trunk may arise from ACA and run at the periphery of the cingulate gyrus, which is very commonly seen in giving internal frontal branches. This is usually called the callosal-marginal artery. There are all these variations, but again, the distal cortical branches of the ACA are constant. Then after giving the origin of the paracentral arteries, which is a major artery to go to the primary motor and sensory areas, the caliber of ACA is reduced to 60%. This is a lateral anatomy of the anterior cerebral artery with the brain. Here is the anterior cerebral artery coming up, and this one has 2 divisions. One goes to the cingulate sulcus, so this is a callosal-marginal artery, and then end up in the paracentral lobule artery. And the other one is the smaller branches, this also called the pericallosal artery, because this is the following the corpus callosum. And this one gives the internal parietal artery branches. So this callosal marginal artery gives a branch to the frontopolar artery, and the 3 medial or internal frontal arteries, anterior, middle, and posterior frontal arteries, and the paracentral lobule artery. So this is another example of, again, dividing the cingulate artery, cingulate sulcus artery, which is a callosal-marginal artery, and pericallosal artery. And then you can see the artery ends up in the very smaller branches to the splenium of the corpus callosum. And this portion has a common vascularization from the PCA territory too. This is the radiographs of the injected brain specimen. You can see in the yellow cingulate sulcus, and here is a marginal sulcus, and the end of the marginal sulcus anterior to it, this is the central sulcus. So here is the primary motor and sensory regions, paracentral lobule, and in this territory there is a big artery coming into, which is the paracentral artery, the paracentral lobule artery. And the other smaller branches include orbital frontal, frontopolar, and then 3 medial or internal frontal arteries, anterior, middle, and posterior. And then after giving a branch of the paracentral lobule artery, you have a very thin internal parietal artery, which goes to the precuneus. And then you can see the very, very tiny artery coming through the splenium of the corpus callosum. And if you look at the inferior aspect of the brain, and you can see the interhemispheric fissure, and then the most medial portion, this is the gyrus rectus, and then lateral to the gyrus rectus, this is the superior frontal gyrus of the orbital frontal region, and those are the ACA, anterior cerebral artery territories. Then you have superior frontal sulcus dividing superior frontal gyrus to the middle frontal gyrus. This area, and the lateral portion, inferior frontal gyrus pars orbitalis, those are the vascularization from middle cerebral artery. So orbitofrontal region has medially ACA, laterally MCA vascularization. On the top of the brain, you can see the brain is cut at the superior frontal sulcus. The anterior cerebral artery runs within the interhemispheric fissure and then comes out, follow the superior surface of the brain, and then enters into the superior frontal sulcus. So that's the border. Superior frontal sulcus is the borderline of the anterior cerebral artery territory. Here is a different territory. The orbitofrontal artery, which goes to the gyrus rectus and the orbital portion of the superior frontal gyrus. Frontopolar artery goes to the anterior pole of the frontal lobe, and anterior, middle, and posterior frontal, medial or internal frontal artery, and then the paracentral lobule artery, and then smaller artery go to the precuneus, and then end up at the spreading of the corpus callosum. And then each vessels are vascularized very constantly in those territories, and then these are divided, border is divided by the superior frontal sulcus. If you look at the lateral view of the internal carotid artery injection, the anterior cerebral artery is, you can see it in very nicely because it runs interhemispheric fissure and then go to this, runs the surface of the frontal lobe and then comes back, enters into the superior frontal sulcus. So if the artery runs superficially and then horizontally and then comes back, goes up, horizontal, comes back, goes up, horizontal, comes back. Those terms are significant for the anterior cerebral artery. Compared to this, the middle cerebral artery is just ends in stretched appearance. So you can identify the anterior cerebral artery. Those are different running patterns compared to the middle cerebral artery. Here's the anterior cerebral artery, the pericallosal branching pattern, and then this going into this paracentral, giving a paracentral lobule, and then interparietal lobule go to the precuneus. And sometimes you can see a very straight pattern of artery coming out from this pericallosal artery. When you see this is the communication from the ACA to the dural branches. The dura is very stretched and straight in form, not like a brain surface of the brain. So if you see a very straight shape of the artery coming out from this ACA, this is the communication to the dural branch. Blue area is the anterior cerebral artery territory. So this is divided by the superior frontal sulcus. So from the interhemispheric fissure to the superior frontal sulcus, that's the anterior cerebral artery territories. Inferiorly, you can see the gyrus rectus and the inferior frontal gyrus. Inferior aspect of the superior frontal gyrus. Those are the ACA territory. The orbitofrontal gyrus and then the inferior frontal gyrus of the pars orbitalis, those are MCA territories. Anterior cerebral artery has, again, the couple of divisions. There is A1, A2. A1 is the transverse horizontal segment, which runs within the very proximal portion. And you can have anterior communicating artery comes at the end of the horizontal segment. And then the anterior cerebral artery comes up towards the interhemispheric fissure and then runs within the interhemispheric fissure. The interhemispheric fissure segment, proximal segment of the interhemispheric fissure portion of anterior cerebral artery called A2 segment and becomes A3 segment at the genu of the corpus callosum. So if you pass the genu of the corpus callosum, that's A3. There is a lots of pattern of variations in the A1, A2 segment divisions. And sometimes you can have early branches of the MCA, even middle cerebral artery coming from the end of the A1 segment or A2 segment. The recurrent artery of Herbner is most commonly coming from the A2 segment or A1 segment. This is a recurrent artery of Herbner, and this is vascularizing the most anterior inferior portion of the head of the caudate nucleus. This also vascularized the some portion of the globus pallidus or internal capsule. In internal frontal branches of ACA, you can see in AP view that divided into through the superior frontal sulcus. So when you see the capillary phase, the enhancement of these structures, that signifying the border of the superior frontal gyrus, and then between superior frontal sulcus and then the MCA territory, that's where the watershed distribution stands for. Again, you can see the basal ganglia sitting here, and then the medial portion of in this basal forebrain, you have a hypothalamus. So ACA is responsible for vascularizing the hypothalamus. This fine injection demonstrating the superior frontal sulcus, and then those are the small ACA branches. So here is the ACA branch coming in and then going into the south side, and then from the surface of the brain you can have a smaller vessels penetrating into the cortex. And then as you can see, the gray matter lesion is more vascularized by the white matter. Inferior aspect, you can see the ACA. This is a horizontal segment, and this is the interhemispheric segment. This is a coronal view. The interhemispheric segment of the ACA comes up and then end up in the superior frontal sulcus, and but in each surface of the branches have extra branches going into the in depth of the white matter. And this is the lenticulostriate artery going into the globus, the caudate nucleus. That's the recurrent artery of Herbner, giving the branch to the head of the caudate nucleus. These are the hypothalamic perforators from ACA, and sagittal hypothalamic perforators from the ACA. And then you can see in the vascularization to the corpus callosum, you have a perpendicular branches going into the corpus callosum. This is a lateral section of the sagittal view. You can see the lenticulostriate artery. This is the caudate head, the caudate body, and the putamen areas. So this was the anterior cerebral artery anatomy.